All right, so the Visiting Doctors Program is a program that provides services to more than 1,000 patients who reside in Manhattan and are homebound, either because they're too frail or too sick to leave their apartments. And so there are a number of physicians who go out and they pay home visits to these patients. And I've had the pleasure of accompanying several of these physicians on home visits. But I first read about it on the Mount Sinai website, and I just became very interested in it. I wanted to go out and meet some of these patients and hear their stories. And that's been my favorite part about participating in the program and going out on home visits and then getting involved in research, is getting to know some of these patients and hearing their voices and seeing what obstacles they're facing, and also how receiving home-based care has really improved their lives. My clinical exposure in the Mount Sinai Visiting Doctors Program has had a big impact on how I look at the whole field of medicine. I think it's taught me to see things from the patient's perspective and to really zoom out. And when we're in class, it's easy to get wrapped up in the details. We're learning about these little worms right now in my microbiology course, and we're learning how to apply all of this in the lab. But going to the Visiting Doctors Program and accompanying physicians on these home visits allowed me to speak with these patients and to see what sort of hurdles they encountered. Some of them live in these walk-up buildings where ordinarily they would be able to leave, but they're homebound just because they're stuck and there's no elevator. So it's allowed me to really appreciate the patient's perspective.